Unity is one of the things na maybe the reason na I told myself na nanuman yung ako. You know, it could have been anybody else. Why me? Well, since the previous elections or since time immemorial basically, us, kaming mga Sagarbarria, we have always been in the center. We have always been trying to be non-partisan, although we have parties, we have teammates, pero our characteristics is number one rule, ginamo is dili pangdaot. So when it comes to elections, we just tell the people na what we are capable of, unsay nabuhat namo, unsay katawhan namo sa mga tao, ug unsay amo ang tamlag na unsay mahitabo pohon sa amo ang gusto na projects. So maybe that is also why. So now, given the chance na nahimo na ko governor, previously it has reached to a point na medyo grabe na kaayo ang division or color ato iso director mana. Kung sa ka grupo on what happened, nakadungog man mo na they have been transferred from tip to tip, from bus, let's say example from Bayawan to Canlaon, switch positions, hoping that they resign so that their items would be open. So for sure, those people would always want vengeance, revenge, and they think that once I come in, ilahan ng panahon, ako mo'y manugpo na pod sa other parties, if ingon ana. But we are not like that. And that is not what I want, and that is not what I stand for. So that's why my core mission in the province is for unity. Nakahisgo, I already told that to the doctors na I understand na amoy kasakit. But let's try to mend all of this. Let's try to work together. This is sa PHO lang eh. I've heard lots of offices with the same, how do we say, kagulaan nila. Naguul sila because nakasakit sila because ibang tugpo sila. They were given a hard time. So, to make it the least political, that's why my first EO was back to barracks and assume your original positions. Kay non-partisan man siya. Whether you are Digamo or Teves or Reyes, any of the political, big, anywhere nila, they will just still retain their original positions. So, wala kayong politikang nahitabo. Then that's why I talk to the department heads na, and the mga employees na, let's try to heal the wounds. Ay, kibalo kong dili sa yun. Ay, ipasakitan mo sila pila ka years. Pero, I told the department heads na, since I am a new governor, you're going to have to respect me and not treat kato inyong ikalagutan or lisod-lisod abi na balik sila. And I also made hangyo those employees na who were mistreated na to understand because politiko man to before and I want to change things. And hopefully, they will unite because that is what I want. Unity and a united province. Well, the first two mayor I met was from the other camp. And they offered their support to me. So, ningon man sila, and this is also coming to also ako ang mga board members, ningon sila, new generation maka-gov. Okay, minimo. We are willing to support your governorship. Tawag ka lang mi, we are willing to support. I also told them na ayaw kabalaka ako, lahi man po ko. So, unsay pangayo ninyo, don't hesitate to request, don't hesitate to ask, kay mutabang yun ko. I have my own personal ideas and projects. But in order to start, the most important thing is employee morale and employees problema. That's why the first thing that I needed to do and bahigyod was the personnel. Because kung ako ang doktor, ito po og layo, I would not like to serve properly. kay gisapot na ko, sakit na kong kasing-kasing. Mugasto pa ko krudo, kay gitugpo ko, and all those things. So I will not be an efficient doctor, or I would not be an efficient nurse. I also wouldn't be an efficient pharmacist, because I even know pharmacists and nurses gipang tugpo ko to before. So nilad kayo. So that's why the revamp of the personnel had to go first. Okay? Number 2, I told the doctors na give me your request, because the priority is to increase balik ato ang ranking. NOPH is still level 1. We were originally level 3 na naog level 1. So I will be asking them what they need from level 1 to level 2 to level 3. This is very important nga naman. Each level musaka ka, you can do certain types of surgeries. That's why bisag ngilngig pa kaayo ato ang mga doktor diha, ngilngig kay ato mga tao, pero natay restrictions because dili malaod, because a hospital cannot reach a certain level. Ato ang mga katawhan dili magpakapaopera sa NOPH. They have to go to the private hospitals, which is very expensive. Kibulo ko ana. So this is a priority thing for me, and I'm not a doctor. That's why I called all them up na give me what you need. I will find the money. I will find whatever kinahanglan niya na medicines. I will find how to help you. Pero that is why I need to work hand in hand. Kay that is a very big difference nga naman. Aside from operations, we have PhilHealth. My goal in term is zero balance billing. Pag sulod ni mo sa provincial, tanan ni mong bill, ma-shoulder sa PhilHealth, ma-shoulder sa malasakit, or other agencies na nakasupport. Pero kani sila, naani sila limitations sa ranking po sa hospital mismo. So, sayon kay paminawa na musulti kag mo increase kag uska level, pero dako kaayo nag-impact yun sa mga tao. And that is not an easy thing to do. Part of it would be even adding new doctors and scholarships to have them trained sa hospital. Have the hospital be capable of giving a scholarship program, a training program sa hospital mismo. And we have to make that system pa. So this is a lot of things na kinahanglan to be done to raise not NOPH alone akong istorya pasabutan niya, kundi every district hospital and every community hospital. So ubay-ubay good eh. So that's why I needed the cooperation sa ng doctors, nurses, medtechs, pharmacists, the cleanliness of the place, the aircon, ilahang disposal of hazard, which I still have not looked at yet. Asa na usahaw na ako na ipang punta ng hazardous waste, because I heard pa dito. So, one step at a time. But this is my focus. A lot of doctors today, I explained to them na if they want a new leadership, sila mo'y ako ang pabuton, or their voice will have a very heavy influence na ako. So, I had them vote secretly kay isod pa na may makabalo kung maghigubos na po. Ano po yung problema? Having a secret voting to who is their preferred head sa PHO and who is their preferred head for the NOPH. And I told them the only person who will ever know about this will be me. So, if I feel na whoever they suggested, and I actually saw the results na, which is quite shocking to me. Ako ka-expect mo mga ngalan na manggawas. Magani ko kailan o pag-doktor. So, I would talk to them and see na if they are actually more capable, then this is also what the doctors wants. This is basically what the people wants. Then maybe I will make changes.